Good afternoon and welcome to our Kaweah Delta bi-weekly webinar. Today's Thursday, April 22nd. My name is Deborah Volison and I'm the Director of Community Engagement for Kaweah Delta. We want to thank those of you who have joined us faithfully since we started doing this back in March of last year. I've lost count of how many we've done because we've done town halls, kid town halls, community relations events, different press conferences, but thank you for those of you who continue to stay engaged. It has been really a pleasure for us to be able to come this way and communicate through webinars, communicate virtually, and we hope you've enjoyed these updates and that they've educated you to where you feel comfortable in what Kaweah Delta has done throughout the pandemic year. Today, of course, I'm joined by Gary Herbst, our hospital CEO, and we're going to spend a little time talking about the COVID numbers like we do every webinar, and then we're going to give you some updates and announcements of things that are happening here across the district. So Gary, welcome.
Yeah, thank you, Deb.
I did call your wife today and tell her that it was Big Hair Day on the webinar. I don't think you got the message.
Well, because she gave me a haircut on Sunday. So all my big hair got cut off on Sunday by her.
Man,
so yeah.
What a bummer.
But your hair looks very nice.
It's very big today. So
you had that one strand that was a bit out of control, but Kelsey got it tamed.
Yeah,
so,
thank you guys for that.
Yeah.
Well, welcome. Always good to see you, Gary.
Thanks. Well, I'm going to have to confess right out of the gate, I'm the most ill-prepared that I think I've ever been in 50 telecasts, so I've been just running around like a madman the last few days. I don't know if you ever noticed, but sometimes I literally am flying into the seat 1 minute before Kelsey says it's broadcast time. But I'm going to try to pull it off and make you believe that I had this all down. So yeah, you want me to start with the numbers?
Let's start with the numbers.
Okay. So I'll start at the state level. The state has now performed 58.5 million tests. Did just 254,000 as of yesterday. So statewide, there's still a lot of testing going on, but we are seeing at both the state level and the local level that the amount of testing, while it's still pretty high, is definitely declining, which is rather interesting. I don't know if folks are no longer interested in knowing if they've had the virus or not, or that so many people by now have been vaccinated or actually contracted and recovered from the virus that there's just a lot fewer people out there that need to be tested now. So just kind of interesting. There now have been 3.6 million Californians that have contracted the virus over the course of the pandemic. The current positivity rate at the state level in terms of those that get tested and those that tested positive over the last 7 days is averaging at 1.5%. You'll learn shortly that, well, I'll tell you now, that's identical to what we're experiencing in Tulare County. So right on top of the state. And the state is also reporting that they're seeing about 4.9 new daily cases of COVID per 100,000 population. So we're actually doing better than that. As of Tuesday, every Tuesday, both the county and the state release their most current COVID statistics. And as of Tuesday, the Tulare County is reporting that we're at 2.9 daily new cases per 100,000 population over the last 7 days. So we're at 2.9 and statewide is at 4.9. And then also the number of deaths per 100,000, and this is obviously the greatest news ever, is that not only we're seeing fewer people become sick and hospitalized, but definitely the number of people that are succumbing to the virus continues to decline. So the state is actually reporting we're down to 0.09 deaths per 100,000 population, which is probably at the lowest that it's been since the beginning of the pandemic. So wonderful news. But we are just a few shy of 60,000 deaths. So 59,992 deaths statewide since the beginning of the pandemic. Just yesterday, 102 Californians died of COVID. So it hasn't gone away. The motivation should be still incredibly strong to get vaccinated because it is proving to be highly, highly effective in keeping COVID-positive patients out of the hospital, keeping them from getting severely sick, and keeping them from dying. Right now, statewide, there are right around 2,100 COVID-positive patients that are hospitalized, and only 479 of them in the ICU. Right now, Kaweah Delta, we only have 3 COVID-positive patients that are in our ICU today, which is actually the
ICU,
lowest level that I can remember. So
I'll let you get to
okay,
it. Sorry.
all right. So that's about a little less than 23% of those Californians that are hospitalized with the virus are actually in the ICU as of right now. In terms of the tiering system, the governor's blueprint for a safer economy, the 4 tiers, the 4 colors, there is not a single county out of the 58 California counties that remain in the purple Tier 1 most restricted. So that is very, very positive news. When you think, it seems like just a month or so ago, 54 of the 58 counties were in purple. So not to have a single county is quite an accomplishment and a tribute to the behavior of our Californians in terms of exercising, very safe practices and getting vaccinated and doing all the right things. California as a whole has done really well. We certainly are hearing states like Michigan are really, they're on the hot burner right now, experiencing major increases in their positivity rate and hospitalizations. And so Californians should be very proud of of what they've accomplished. Of those 58 counties, 17 are in the red substantial Tier 2. 38 of the counties, including Tulare County, are in orange or moderate transmission, Tier 3. And we still have those pesky 3 counties that are in that Tier 4 yellow, most unrestricted, and in fact called minimal transition. But Tulare County continues to be on the cusp of moving into that most open category. So that's where we are at the state level. So kind of taking that same information and moving it down to the county level. As of Tuesday, across all of Tulare County, and this is not just the county public health department, but also would include Kaweah Delta and anybody in Tulare County that's conducting COVID tests. We've now performed 509,000 tests since the beginning of the pandemic. 49,444 Tulare County residents tested positive for the virus. As I mentioned earlier, our 7-day average positivity rate stands at 1.5% right now. And our health equity positivity rate, so the people that live kind of in the most impoverished, most challenged from a health standpoint, that area is also at 1.5%. Both of those metrics put us in the yellow Tier 4 category. So there's no improvement. If we just hold strong there and continue that experience, we just need our 7-day average new daily case rate to fall below 2 per day per 100,000 population, and we're at 2.9. So we're very, very close. In fact, what was very exciting, I don't think I've seen this throughout the entire course of the pandemic, but the county reported yesterday that they only had 1 case, 1 new positive case reported countywide. So out of 484,000 people, only 1 person reported positive yesterday. We had 0 deaths yesterday, and we've been standing pretty constant in the low 800s. So we're at 831 total deaths across the entire county since the beginning of the pandemic. We now have at least 142,000 Tulare County residents that have received at least 1 dose of the vaccine. The county has received actually more than 284,000 doses of the vaccine since they started distributing it. That means we still have about 140,000 unused doses, which is a bit disconcerting. So in addition to the number of COVID tests that are being performed, that being on the decline, I think what we're also seeing is the number of vaccinations is also on the decline. That there are literally counties that are reporting hundreds, if not thousands, of their vaccination appointments are actually going unfilled. So people are not, signing up for a vaccine, which is quite different. When it started rolling out in December, literally those open spots would be snatched up in a nanosecond. As soon as they became available, boom, they were gone. And that's been changing quite a bit. And that actually is what we're seeing, again, in the region, statewide, and nationwide. And again, I don't know if that's because we have so many people that have now been vaccinated or contracted the virus and believe that their natural antibodies are sufficient and they don't want to get another vaccine. There's still a high percentage of people that have made a decision that they're not going to get vaccinated at all. And as a result, I did listen to Dr. Fauci and the CDC, where they were suggesting that we need to get somewhere between 75% and 85% of our people in the country would have to either get vaccinated or have had the virus and had the natural antibodies, that you have to hit between 75 and 85% to hit that herd immunity threshold and basically then to see the virus disappear. Now they pretty much have believed that we will not achieve herd immunity. That given what we're seeing in the population, unless there was to be some huge shift, that we're probably not going to hit herd immunity, and as a result, we will continue to need to be vaccinated and continue to practice mask wearing and distancing on some measure. And I see Deb scowling over here.
Okay, well, let me ask you a question.
Yeah.
So, are they tracking like those who have tested positive versus those who have received the vaccine? And I mean, because like not everybody who tested positive for COVID got the vaccine, but they still have the natural immunity.
Correct.
So could that play? Are we just going by the percentage of those who have received the vaccine?
No, they're actually combining it. So
okay.
We do know that people that got the virus and recovered from the virus and most likely have natural antibodies, the CDC was still encouraging them to also get vaccinated because there's still so little we know about the antibodies and the T cells and the B cells and how long do they last or how strong, are the antibodies in any given individual. And we've seen, when we were doing antibody testing last summer, we did see that the level of antibodies varied by person. And it could have been, your individual immune response. It could have been, how severe you were affected by the virus. So there's just so much that's still unknown about the antibodies. But at least what I was, listening to the other day is that they are looking at the people that, tested positive, so they had the virus, plus those that did not contract the virus but did get vaccinated. If we add those two together, what percentage are we at? And it's still well below 75%. But that could change,
right,
as attitudes change. And so, all right, so that's what's going on at the county level. And now here at Kaweah Delta, we continue to be a very busy hospital. As of early this morning, our adult beds in the acute medical center downtown Visalia were 88% occupied. So that is lower than the 97 to almost 100% occupancy that we were experiencing back in the winter months. So that's been a nice reprieve for our staff. And we do have quite a bit of availability in the critical care areas. So we have 17 of our 41 ICU beds are currently open right now to take care of patients of all kinds. And we have 14 of our 54 intermediate critical care beds that are open. So really the areas that have been most impacted are the general medical surgical beds, because we still, there is no slow period of the year anymore. We always used to think that healthcare was rather seasonal in a hospital. Hospitals get traditionally very, very busy in the winter respiratory months, whether it's the flu or pneumonia, other respiratory conditions. But it seems like Kaweah Delta's full all year long now. Just the different cases, the types of cases we take care of just vary. And then a couple other things. Again, we have 16 COVID positive cases that are in the medical center right now. So out of 344 adult beds, only 16 of our patients are currently COVID positive. And we seem to have plateaued at that level. We've been hovering 15 to 18 over the last probably month. So that's good. But again, of those 16, only 3 of them today in the ICU. All of them are on ventilators. But again, every month that passes, we continue to gain experience and knowledge about treating these patients. We have an incredible team of critical care intensivists, our adult hospitalists, our nurses, our respiratory therapists, our pharmacists just do an amazing job taking care and bringing our COVID patients to full recovery. So it used to be, very depressing and discouraging in the early period of the pandemic, and you felt somewhat helpless. But I think, again, all the experience that we've gained, and not just as a hospital, but as a country, the knowledge we've experienced and gained has really allowed us to be a lot more successful in helping patients recover. Yeah. Last thing, number of employees. I know that's always of interest. So we've had now 1,170 of our employees have contracted the virus over the more than year-long pandemic. Only 17 of them are still out on a leave of absence. Interestingly, I think I might have reported this a couple weeks ago that 12 of those 17 have actually been out on leave before the beginning of the year. So we do touch base with them. We reach out, and some just aren't ready to come back. Some might be what they call the long haul recovers that are just taking them longer. We don't have any of our COVID positive employees that are hospitalized right now, so that's very good news. And we don't have any of our physicians or other providers that are out on leave. So my report for this week is just as positive as it was a couple weeks ago.
Yeah. So let's go back to the tiers. So yellow, to move into yellow,
right,
we need to be below 2
right.
per
So
day.
there's 3 metrics.
Right.
Your overall positivity rate for the county, your positivity rate in that most challenged quartile, and the number of average new daily cases per 100,000.
Right.
So the 2 positivity rates are both at 1.5% and already qualify for Tier 4 yellow. The one that's holding us back in the orange is the daily new cases,
Right.
and we have to be below 2, and we're right now, and you could be at 1.99.
Right.
Just have to be at below 2,
I'm
and we are
trying to-
currently at 2.9.
And our rolling 7 days starts every Tuesday?
Yes.
Okay.
Yep.
So next Tuesday, if we continue this way, we could possibly move to yellow?
It's been bumping up and down. So obviously only having 1 new positive case yesterday, that's below 2.
Right.
So and that's over 484,000 people though. So we actually could have had close to 5. If you're 5 or below every day, that's 1.0. So we actually can be at about 10.
And still meet that.
Yeah, because it's per 100,000. Right. So 484,000 is close to 5 times 100,000. So 5 times 2.0 would be 10 daily new cases. So we got to be below 10, probably close to 9. You know, if we had 9 daily new cases over the next 7 days, then we could see ourselves move into that yellow tier 4.
And what happens when we go to yellow? So that I can dream about yellow.
Yeah, all kinds of things.
Is it just wide open?
It's mostly, no, I think there's still requirements that you still have social distancing and mask wearing, but occupancies. We're now in the orange category. Movie theaters, restaurants, churches, things like that started moving to the 50% occupancy from 25%. So generally the occupancy levels now move to 75%. And there probably are a few businesses that, I don't know, bars that don't serve food. Maybe they can only be outdoor right now, although we know most of the indoors are open. But legally, they're supposed to be outdoor, but if we get to the yellow tier 4, then they get to move indoors. And so maybe our next broadcast, I'll bring back that the tiering, and because I did cover that one time, what happens at each tier.
But then there's word that on June 15th.
Yeah.
So are the tiers even going to matter?
Maybe not. So yeah, the governor said a couple weeks ago that on June 15th, depending on the metrics statewide, that he's going to open up the entire state. And I don't know exactly what does that mean. Does he abandon the blueprint for a safer economy? And he basically says everybody is now the equivalent of yellow, and there is no more yellow. Everything's wide open, and you go back to pre-COVID activities or restrictions or no restrictions, but we still expect you to mask and socially distance.
Yeah.
I don't think I've seen the details of what wide open looks like.
Yeah.
So.
All right. So visitor policy updates.
Yeah. So I just talked to Emma Mosier this morning. She's our visitor policy czar, her guru. And there have been no changes since I reported on it 2 weeks ago. So, general adult visitation, still 1 visitor per day between 10 a.m. and 9 p.m. for non-COVID patients. And that 1 visitor can rotate among the family day after day after day. So it doesn't have to be that same person. No visitation yet of COVID positive patients except in limited cases. So again, death is imminent, mental disabilities or ability for the patient to be able to communicate or interact with folks. Generally those, the end of life, deteriorating conditions, they're going to undergo major trauma like open heart surgery or neurosurgery. And at all times, the staff in charge, whether it's the physicians or the charge nurse on the unit, always has the discretion to make exceptions when it makes sense in that case to help the patient or help the caregiving team. Critical care units, they also have 1 visitor, but there's 2 slots, 10 a.m. to 5 p.m. and then 7 p.m. to 9 p.m. In the NICU, they're allowed 2 visitors from 9 a.m. to 6 p.m. and one of those visitors can spend the night. Peds are allowed 2 visitors 24/7. So 24 hours a day, 7 days a week. Labor and delivery is allowed 1 visitor, again 24 hours, 7 days a week. We are looking right now, and again we continue to evaluate it, at 88% occupancy, still we're very full, very busy. And we still, COVID is still out there, variants are still out there, so we're still cautious, but we do greatly value the impact that visitation has on healing and helping our staff do an exceptional job. So looking to expand the hours from 10 a.m., dropping that down to 8 a.m. to 9 p.m., and then allowing 2 visitors at a time instead of 1. So that may be coming very soon. We've kind of been following the tiering in some respect. When we moved into orange, we opened up visitation. If we move into yellow, that's probably what will trigger that next
Okay.
relaxing of visitation.
Okay. And so we'll just throw in here, because we might have some ministers on the call today from our faith ambassadors. That number of visitors does not include a chaplain or a minister. And so if a family requests a minister, work with Kent Mishler with the chaplaincy office, because there are times that they are allowing the ministers up there on top of that one visitor.
Right.
So don't let that,
Right.
dissuade you from doing that. And also, I received a question from a community member last week about labor and delivery and whether women in labor have to wear masks. And yes, they do, unless the mask starts to cause the mom panic or if she's struggling to breathe. And this is, I saw a post from a friend in Louisiana, so I guess this is a nationwide thing that mothers in labor do have to mask for the protection of the labor and delivery staff.
Sure.
And so unless she's struggling to breathe or if there's an issue, she will be required to wear a mask. So
One of the most delightful things that happened this week for us is 2 days ago, again, because of the improving conditions in the hospital, we made a change, I guess on Tuesday, that our employees no longer have to wear N95 masks or shields if they're taking care of non-COVID patients. So if you're taking care of a COVID patient, you still have to wear that protective N95 mask and a face shield. But if you're not, then you can now just wear a simple surgical mask. And I cannot tell you how welcome that news has been for our providers.
right. Okay, so what is the status of the ED opening?
Yeah, so breaking news.
Oh,
Yes, so on Monday, what was that, April 19th, we were all prepared to receive the surveyors from the California Department of Public Health. So we were in a ready state. Actually, we're prepared. We could have taken care of patients that very day, which is the condition you have to be in when CDPH does come on site. And unfortunately, as much as we were encouraging them and cajoling them and persuading everything Ben Cripps could possibly do to accelerate their arrival, we received word yesterday that they have scheduled their on-site survey for next Thursday, a week from today, at 9 o'clock in the morning. We expect that survey is going to go wonderful. And generally, the next day, if you get the green light and you have no deficiencies that need to, be immediately cleared, they might find things in a policy or something like that. But if the actual conditions and the preparedness and the ability to safely and effectively treat patients, if that all goes well on Thursday, we actually could start seeing patients on Friday. So that will mark the culmination of what has been a 2-year, 3-phase major expansion of the emergency department. 2 years ago, it's been about 2 years, we completed the 8-bed Zone 6, what we call fast track for low acuity patients. That really wasn't an emergent condition, but still had a condition that they needed treatment for, and so get them in and out, and took a lot of pressure off the main part of the ED. And then not too long after that, this was in kind of late 2020, we finished Zone 4, which is a 9-bed unit, primarily focused on patients that are experiencing a severe mental crisis. So either a danger to themselves or a danger to other. All 9 of those exam rooms are what are called ligature-free, meaning that there is nothing that the patient could use in any way to harm themselves. So they tend to be very unique space, and we have psychiatrists and mental health techs that staff that unit along with nurses and other providers. So what we're ready for, waiting on next Thursday, would be the survey of Zone 5, which is a 24-bed, I would say moderate acuity of patients, so not trauma, not the serious. That's still zone 2 of the emergency department, where we take care of the most serious of emergencies. We now increased our total ED capacity from 31 exam rooms to 73. So that is pretty remarkable, particularly for an emergency department that when it first opened was designed to care for 36,000 people, and we now care for more than 90,000. And also our waiting room. The waiting room is really zone 5. That's the only, we didn't do any waiting room alterations when we worked on zone 6 and zone 4, but zone 5 with this big, large, expansive waiting room increases our waiting room capacity from 65 chairs to more than 100. So we are incredibly excited. A number of you may have actually gone through and toured the facility, and hope you found it as exciting as we did.
Yeah, and then the day after the community members came through, our employees came through. And so keep in mind that this is a large organization, and although we've been working on the ED for 2 years, a lot of employees have never had the opportunity to walk through it or see behind the scenes. So about 230 of our employees walked through, and it was a really great experience, because that's the biggest thing we've done here at Kaweah Delta since the Kaweah wing.
Yes.
I mean, it's a big deal.
It is a big deal.
And to watch the employees walk in and
Right.
gasp when they see that huge waiting room, and then our ED staff there to greet them, just so filled with pride.
Yes.
I mean, it was a wonderful experience for us getting to be there during those tours.
I'm just sitting here kind of grinning, envisioning the before and after. So the tours, you all saw the before. You all saw during a very peaceful time and serene, and everything shiny and beautiful and bright and quiet, and that will all change here very shortly. And we probably should have toured you through zones 1, 2, and 3, either before or after you went through zone 5.
We'll keep those locked up.
We do need to remember that we will put it into operation, and there'll be a lot of staff, and there'll be a lot of patients, and so that's the most exciting part. It's beautiful to see, but to be able to now be able to treat people more quickly, so that we can take them back out of the waiting room more quickly into the exam room. I think it also will improve our ability to recruit and retain top-notch physicians and nurses and other staff who want to work in very new, modern facilities with modern technology. But they want to work in a place that's challenging, where they see a lot of pathology, a lot of different types of cases, and that's really what attracts those top-notch providers. And to be a level 3 trauma center to 90,000 visits a year, that's a magnet for pulling really top-notch staff.
Well, and one of the things that happened during both of the tours was the helicopter came in. And, I try to turn off a certain part of my brain, because I'm filled with pride, because we worked in the foundation and so many of our community members, helped support that financially. So I was really excited that they got to be there to watch it in action. But then the other side of my brain was saying, but that's a patient.
Yeah, exactly.
We're saving someone's life, and that's when the emotions come in. But to get to stand there and experience that for those community members was just a really great experience, reminding them of everything that Kaweah Delta does for trauma, for ED, and how important it was that we brought in the helipad when we did that, a few years ago.
Right.
But just
being in healthcare, working for a hospital, is unique. And I'm sure we told everyone that toured through the ED, we hope this is the first and only time that you'll ever have to be here. And that's kind of odd to say.
Yeah.
In any other business, and you welcome your customers back.
And you say, come back again soon.
Yeah, come back again soon. And here I'm saying, I hope you never come.
Yeah.
But then you finish that sentence, But if you ever need us, we will be here for you.
Right.
And we'll be here for you when it's potentially one of the most traumatic, anxious-filled times of your life. And so I think there's incredible peace of mind in our community knowing that if I ever become seriously sick or injured or a loved one does, that I have a place that I can go to immediately and have a high degree of confidence that they will take care of me. They will cure me. They will heal my injuries. And
Right.
so it is kind of different.
Yeah, it is. So what about, you mentioned staffing in there. So how are we doing staffing wise as we expand our facilities? You know, we were struggling with staffing before.
Right.
So how are we doing with staffing here at
Yes,
the district?
you know, I think staffing, particularly in the San Joaquin Valley, will always be a challenge for us. No doubt about it. You know, when you have 1,200 employees that contract the virus, you know, I think at our high water mark, we had almost 300 of them were out on leave, and we were really feeling squeezed, relying a lot on nurses working extra shifts and overtime and contracting with travelers. And so that is vastly improved. With most of our employees now back to work, we also had a great recruiting season this last year and hiring a lot of new nurses. In fact, this week, just a couple days ago, we had our annual hiring event over at the convention center and had great success. We made a lot of offers.
We made
to
45.
nurses. 45. Oh,
Brittany,
thank you.
Brittany texted me.
Yeah.
We made 45 at that
Awesome.
event and 20 right before that event.
Wonderful.
So,
So things have definitely improved. We saw the amount of money that we paid, I think, again, the highest in a single pay period for that extra shift, to have a nurse work a fourth shift instead of just the normal 3, was like $450,000 in one pay period. This last pay period, it was $70,000.
oh, wow.
So we definitely are needing less and less to have our staff work extra shifts, and that's good. They're catching their breath. They're
Yeah.
getting some rest, and bless them for what they did through the difficult times. But we still have 450 open positions right now that are posted, but they're unfilled. Some, you know, that we just kind of suck it up, and other people, you know, do that work if they might be in a more of an administrative support role. But if they are nurses, we are regulatorily required to still staff it, so that will come through overtime or extra shift, or we do still have travelers here. The ED has been tough. You know, it's a tough place to work. It takes a unique individual that you want to be where the action is, because that's definitely where it happens. And so it has a higher percentage of turnover there. And so we've actually found ourselves in the last couple months having to even close units because we couldn't staff them. So Zone 6 was closed at times, parts of Zone 1. But again, you know, things are looking much more promising from a staffing point, even in the ED going forward.
Okay, wonderful. So just keeping with the COVID theme, we did our 3rd Kids Town Hall this week, and this time we partnered with Farmersville Unified
Great.
School District, and Dr. Saviano came over and spent a little time with us, and it's kind of neat to just switch gears from the adult communication that we do regularly to get to talk to kids. And we had several kids submit questions and jump on for that town hall. And the Farmersville Unified School District was just so happy to get to partner with Kaweah Delta.
That's great.
And I received several thank you emails from them the next day saying, you know, our kids were so excited. We were so proud of our superintendent and, you know, all of this stuff. But he was really talking about, and I was going to ask you in advance and I forgot to do it, but he was talking about the huge toll that COVID has had on the city of Farmersville. And I wasn't sure if that city had a larger percentage of COVID deaths or a COVID numbers, but he was talking about just how they're having to change the way they're interacting with kids just due to the amount of grief and stress that their community has had this
Right.
year during COVID. So I would be interested to know, per town, the percentage.
I actually provided that in one of my telecasts.
It feels like it's been a long time ago.
It has.
Okay.
But that information actually is out on the county website, so you can go see it. It's a little tricky getting to, but it literally shows countywide by city the number. I don't know if it has their positivity rate, but it has the number of positive COVID cases and the number of deaths.
Okay.
And without a doubt, that's the whole basis behind this health equity positivity metric. Now, we generally think of Farmersville as a more impoverished area that's largely agricultural, if not entirely agricultural. There's a lot of congregate living? Is
Okay.
that where you have many households that are living under one roof, and so you have one person contract the virus, it quickly spreads throughout the entire household. So definitely in those more impoverished areas, Goshen, Cutler, Orosi, Farmersville, Ivanhoe, we did see higher positivity rates and higher death rates. So that doesn't surprise me to hear that they were hit harder than other communities.
Interesting. Yeah, but it was a really exciting event. It was the first time we've partnered with Farmersville on any sort of webinar or community event. So it was a really fun thing this week. And then another really unique thing that we did this week, Gary, was you dedicated a memorial fence yesterday.
Yes.
So you want to tell our viewers a little bit what that was about?
Yeah. It was a special day.
It was very special.
It was a special. It was a solemn day, but it also, in many respects, was a rewarding and fulfilling day. Something that we've actually been looking at for a couple years. We have a group of employees called our Employee Connection team that is always looking at new ways that we can connect with our employees, and one of our underlying pillars to create an ideal work environment where our employees feel valued and appreciated and supported. We create that feeling of the Kaweah Delta family. And sadly, and probably was really spurred on by the pandemic, that over this last year and even a little bit longer, we've lost a number of our Kaweah Delta family members. We lost 4 of them to COVID, but also we've lost them to cancer. Chrissy Lewis, 22-year nurse in our cardiovascular ICU, was one of the folks that died in that tragic boating accident on the Colorado River. So the Kaweah Delta family is not immune to sadness and losing family members. And we were talking yesterday about families, have more formal ways to grieve their losses, either funerals and burials, and which are very sad events. But the work family here doesn't. Oftentimes they're not involved in those family events, and yet they still feel a huge loss when they lose a fellow employee or a colleague. And so they wanted to do something where they could help fill that hole, where they could memorialize their colleague that had passed away while they were actively working at Kaweah Delta. So it was the brainchild of this group that wanted to create a formal memorial, like a wall, or in this case it was a fence. And so right on our support services building that fronts Mineral King, on the the north end of Mineral King, and then the west side of West Street and the east side of Willis Street is our 5-story support services building. And there's the creek that runs right along that building, and then there's a walking path and kind of a park-like setting. In fact, we call it Kaweah Park. Very serene, very peaceful. In fact, there are tables there that a lot of our employees come to just kind of get away from it all and just reflect and contemplate. And so we erected a wrought iron fence along that walking path. And we have placed a plaque for each individual employee or physician or a physician assistant, a nurse practitioner, anybody that was on the medical staff of Kaweah Delta or on the employee staff of Kaweah Delta. We only went back to 2018, so we didn't go back all the way in time. But we kind of said beginning with 2018 and now going forward forever, any Kaweah Delta employee or member of the medical staff that passes away for whatever cause or reason while they are actively part of the Kaweah Delta family, that we will forever memorialize their service to Kaweah Delta and their passing by placing a plaque. And each individual person has their own plaque with their name, the position, the years of service that they were with Kaweah Delta. So I'll say inducted, but we recognized and honored 16 of our fallen Kaweah Delta family members yesterday, and we had 7 of the families that joined us, hundreds of employees, and it was a very special morning. We unveiled the wall and then released white doves into the air, and a lot of tears were shed. But it really was a celebration of life, and I know the family members and the staff, the colleagues of those fallen employees felt really special about it. So yeah, it was
great.
nice.
A great thing to do
Yep.
here at the hospital. So we have a question. Have you seen any COVID positive patients that are fully vaccinated?
You know, I don't know the answer to that. It's a great question, and I think I'd suggested that maybe we could start tracking that. If that we ask a patient, have you been fully vaccinated, but were hospitalized. My wife she commented to me this morning, I was running out the door, but I don't know if she got a text or something referencing 7 fully vaccinated people that were currently in the hospital with COVID. And she was kind of upset by that, and I had to remind her, said, honey, I've told you this, and others, that getting fully vaccinated does not prevent you or guarantee that you won't contract the virus. Just like the flu, fully vaccinated, you could still get the flu. Because it wasn't actually designed by Pfizer or Moderna or Johnson & Johnson to prevent you from getting the virus. It was designed to prevent you from getting really sick from the virus and needing to be hospitalized or dying of it. So that was the whole design behind it. Now, recent studies have shown that it actually might prevent or minimize the chance of contracting the virus, or if you do contract it, virtually no chance of transmitting it to somebody else, which is why we still have to wear a mask after we get vaccinated, because you can still get the virus and you can still transmit it to somebody that maybe hasn't been vaccinated and maybe can't be vaccinated because just their immunocompromised condition they might be in. So yeah, you can get the virus and you can get hospitalized. Remember, they're 95% effective, so that means 5%, and I believe that 95% came from their study. So Pfizer and Moderna had 71,000 people enrolled in their study, and 5% of those who got the vaccination the vaccine and not the placebo, 5% of them ended up getting sick enough with COVID that they had to be hospitalized. So that's where you say it's 95% effective, keeping you out of the hospital, but 5% still ended up getting sick, getting hospitalized. So that was their study group of 71,000 people. Now we've vaccinated tens of, maybe hundreds of millions of people now, and so I haven't heard, okay, what's the real life experience now? Are we seeing that a higher percentage of those that got vaccinated ended up being hospitalized? I don't know. So we don't ask that question right now. Maybe we should.
Is there a vaccination database?
I have not seen anything.
Or is it just the little card you carry around that
It's
proves
pretty
that
much-
you've been vaccinated?
There's got to be a database at the county level, certainly. I mean, yeah, there's the Cal Ready system that the state maintains for really tracking all kinds of viruses. And, you know, right now you go into the My Turn application to schedule your appointment. I'm pretty confident that both the county and we report vaccinations to the state, but I don't know if we give the name of the people. I mean, that's why there are companies out there that will laminate your vaccination card for you, like a form of ID. So I don't know.
I know people ask us about our staff, but now that we're not vaccinating here at the hospital, you know, our staff members could go to any of the sites, so it's very hard for us to track our staff.
Exactly, and I asked that question, that exact question yesterday of Doug Leeper, because we know that when we were conducting all the vaccinations during that initial period, we had about a 60% acceptance rate, meaning 60% of our 5,100 employees and our 700 providers chose to get vaccinated. Another 40% chose not to. 20% of, or half of them said, I don't ever intend to get the vaccine. The other half said, I'm going to wait. So, but then we stopped providing the in-house vaccination. But it could be that those that were undecided have since gone out and got vaccinated at a county event or something like that. And I was telling Doug, well, you know, during flu season, flu vaccination is mandatory at Kaweah Delta. If you don't, there are exceptions, and if you qualify for one of those exceptions and you don't get vaccinated, then you have to wear a mask the entire flu season. But you don't have to get your flu vaccine at Kaweah Delta. If you go get it someplace else, though, you have to bring that evidence of vaccination back to employee health. So when it comes to the flu vaccine, we know every single one of our employees or physicians by name who was vaccinated and not. We do not know that right now for COVID. But I think it would be beneficial to us. And I was telling Doug that, you know, we may not achieve herd immunity at the state or national level, but what if we achieved herd immunity at Kaweah Delta? So what if we did get the 80 to 90% of our employees had either been vaccinated or had had the virus? And so now when we meet in meeting rooms or in break rooms, we still all wear masks. You know, if even, you know, we can voluntarily say, hey, has everyone been vaccinated here? But in some respects, that's private information too. But I think it might be helpful for shaping our masking protocols here and allowing staff to gather and interact if we did have a employee database. So, yeah, I think that's something we'll consider.
Even when patients come in, you're just going to be taking their word, right? If they say I'm vaccinated, you know. So for us to be able to accurately say that somebody got COVID that had been vaccinated, we would need to be able to prove that they were vaccinated.
We would, which kind of comes to the airline passport. A hospital passport? Yeah.
Right.
I think it'd be highly unlikely that somebody would tell us that they had been vaccinated when they hadn't, because I think that would be important medical information to know, particularly, in terms of how they might.
Unless they thought you weren't going to treat them unless they were.
Yeah.
I'm playing devil's advocate.
Yeah. So, how are we doing on time? 6 minutes.
Okay, do we offer vaccine to our new hires? Yes, we do.
Yes.
Yes,
we
do.
We're vaccinating at both of our urgent care centers, so we would probably send them to Court or Demery, and we may by now be vaccinating at our various rural health clinics. So yes, we definitely offer vaccination to our new employees, as well as those who may have changed their minds by now. They didn't get, you know, they're not new employees, but they didn't get vaccinated originally and now want to be vaccinated.
Right.
Yeah.
And one of our community members just wants us to remind the community the importance of wearing a mask, because you know, everything's kind of lightening up now and people are feeling really comfortable. And those of us who love to be mask free, she just wants to remind everybody to be aware of the people around you too. If you're around people who are wearing masks, then put your mask on. Just make sure that everybody is comfortable and that you respect each other.
We have said from the very beginning, wearing a mask is showing your fellow human being that you care about their safety. The mask is not really for your own safety, it's to protect others from you.
Yeah.
And those risks still exist. And I was in Save Mart earlier this week, and the clerk that was waiting on me, I guess they call it a chin diaper or something like that's the word.
Oh, when it's down?
Yeah, they literally, their mask was all the way down under their chin, full nose exposure, mouth exposure, and I just had to chuckle like,
yeah.
Anyway.
Yeah. Okay, so it looks like we're having a few technical difficulties, so I apologize if our video has been in and out today. But it wouldn't be a good way to celebrate a year than it's the best way because, we started out this way, Gary. And I would like to say that we are professionals now, but
we are
we're
still amateurs,
right?
aren't we?
We are what we are.
Yeah.
So if you'd like to close it out.
Well, I'm gonna maybe reveal something. I'm not gonna reveal it entirely because, but tomorrow, I think tomorrow morning, you will all be receiving an email from me with a big announcement, and there's a video link. So I'm just gonna suggest to you that when you get that email, that you, rather than read the email, that you quickly go down to the bottom of the email where you see that video link, and I'd like you to click on that video link for the big announcement. And I'm not going to tell you today, and I apologize that I'm keeping you in suspense. It may not be the best kept secret, and a number of you may be already aware of this big news, but it is significant in the life of Kaweah Delta. And but I kind of feel bad having kept it a secret from you. But it's not just you. We've kept it a secret from all of our employees and our community because we want it to be a surprise. We want it to be an exciting announcement for the organization. But you're also a special group of people to us that we want you always to be the first to be informed. So I would spend a long time telling you about it and the why and the what and the how behind it. But I just wanted to apologize in advance when you read this. It's like, wow, why didn't Gary tell us about this? And it really was to create that surprise for you. So,
and you'll actually be getting the email from me, and I'm forwarding it. So
Okay.
I'll make sure that my subject line is very woohoo surprise so that you all know that it's the surprise. And you should be getting it about 8 o'clock tomorrow morning.
okay.
So,
All right.
surprise!
Yes, surprise. So again, thank you for all of you for being here with us and staying with us. And I hope, again, you're as excited about the news as we are. I want to credit you, our community engagement folks, and many of you actually were involved in the decision making behind this. So again, I know I'm just tossing out teases here and there, but just want to say thank you for continuing to be influential in helping make Kaweah Delta a better organization